Okay, party people, let's make some noise. Let's make a splash in the SIBO community yet again. In today's video, we're going to be talking about SIBO versus SIBO syndrome. Or you could think of it as old school versus new school SIBO. Try to figure out which of the two might you have and what does that mean for you clinically. So without further ado, let's put me in head bubble mode and we'll see if we can make sense of old school versus new school SIBO, SIBO versus SIBO syndrome, whatever you want to call it. Let's put me in head bubble mode. Now I'm going to be using some slides from my healthcare practitioner course, SIBO Hero. This is one of many topics that we cover in that course, really try to teach practitioners how to accurately define SIBO and how to accurately tell people when they do not have SIBO and how to prioritize things based on that knowledge. So let's get into this conversation of how many is too many. So remembering that SIBO is classically considered to be too many bacteria in the small bowel. The quantity is too high, but what quantity are we going to consider to be too high? Right? Like, what is the cutoff? You would think that we would have that pretty well established in this day and age, but in truth, we don't. This is much more of a gray area topic than you realize. It's actually possibly a little bit political too, because some of the powers that be that are trying to lower the threshold for defining SIBO stand to make a lot of money if they sell a lot of rifaximin or a lot of SIBO breath tests. So there's a lot of conflict of interest in this as well. So let's look at this paper. I think this is an exceptionally well done paper. That's the PubMed ID if you want to go find it. Small intestinal bacterial overgrowth syndrome, a guide for the appropriate use of breath testing. And they said, in its historically recognized form, think old school, SIBO syndrome consists of a clinical condition in which there is an abnormal proliferation of bacteria within the lumen of the small intestine, such that their metabolism of the luminal contents alters the normal processes of digestion and absorption to a clinically significant degree. The classic abnormality has been vitamin B12 deficiency with associated megaloblastic anemia, but other consequences have included fat malabsorption, protein loss, various nutritional deficiencies, and intestinal pneumatosis. Continuing. Common gastrointestinal manifestations have included the expected symptoms of malabsorption and excess bacterial fermentation, such as diarrhea, bloating, excessive flatulence, and weight loss, while specific nutrient deficiencies could result in other manifestations such as peripheral edema and polyneuropathy. A distinction needs to be made between the historically recognized syndrome associated with SIBO and the presence of SIBO itself, which may or may not have the metabolic consequences of the syndrome. In its simplest form, SIBO has been defined as the presence of excessive numbers of coliform bacteria in the small intestine. You sticking with me so far? So, by the numbers, up until this point, a lot of papers have used the 10 to the 5th cutoff. But in more recent research, you see a lot of papers now, including Dr. Pimentel's, that are using 10 to the 3rd as their cutoff. And as you might remember from the accuracy of SIBO breath testing videos, when you drop that threshold, you start to get a lot of false positives. So yes, you might correctly identify more people who have real SIBO, but you're also going to tell a whole buttload of people who don't have SIBO that they do, and that is incorrect, and that could be harmful, especially when the treatment is antibiotics. But it gets worse. So 10 to the 5th, just remember that number. So for those of you who don't remember, you move the decimal point over 5 times. So 10 to the 5th looks a little something like that. 1 million, if I'm doing my maths right. Versus 10 to the 3rd is 10,000. There's a big freaking difference between 10,000 bacteria and 1 million. But wait, there's more. It gets worse. True SIBO syndrome patients, so old school SIBO, the original research on SIBO, have much higher bacterial concentrations in the range of 10 to the 7th to 10 to the 9th CFU per ml. When lower bacterial concentrations are used to define SIBO, fewer patients are found to have the underlying condition historically associated with SIBO. Furthermore, with low cutoff concentrations for determining SIBO, symptoms do not correlate strongly with the presence of SIBO. Why are we talking about this if it doesn't correlate with or cause your dang symptoms? and the patients are not observed to have additional clinical benefit from antibiotic therapy. Holy crappity crap, guys. So remembering math. Again, 1 million was 10 to the 5th. 10 to the 7th is 100 million. And now 10 to the 9th, that's 10 billion. So where does the cutoff really lie? Do we need to be telling people they have SIBO if they have 10 billion bacteria per CFU? Do we need to be telling them they have SIBO when they have 100 million CFU per ml? Or are we really honestly going to start telling people that they have SIBO when they have 10,000 CFU per ml? Let me get off head bubble. Personally, I think the overdiagnosis of SIBO is one of the biggest cluster you-know-whats of the 2010s and 2020s. The rise of SIBO in 2015, 2016, and all of the summits, all of the books, all of the podcasts and YouTube channels like mine, I think that we are eventually going to find that we've been overdiagnosing the snot out of this condition. Meanwhile, we're telling people who have breath test results that are faulty because breath testing just sucks and is not accurate in the least bit. We're telling people with positive breath test results, or we're telling people with aspirates with 10 to the 3rd CFU per ml, we're telling those people they have SIBO, and then they're on this wild goose chase, taking antibiotics and prokinetics, and they're trying to do fasting for their MMC, and they're scrambling, and they're not feeling better, and they're restricting their diet, and it's just a freaking nightmare. I'm sure some of you who are watching this video right now do really honestly have SIBO, and maybe like one person who watches this channel has true SIBO syndrome, but honestly, I think that most of you who have received the diagnosis of SIBO did so erroneously. The people who gave you those tests or interpreted those tests maybe weren't as up to date on the research as they could have been, or they were following other research. I don't know. I don't want it to sound egotistical and say like, they're not as smart as me. But honestly, I think that a lot of you probably don't have SIBO. And if you do have SIBO, you sure as heck don't have SIBO syndrome with the malabsorption and these deficiencies that get talked about. I can't tell you how many times a well-intentioned but knuckleheaded functional medicine doctor or naturopath told one of my patients or one of my FODMAP Freedom students that they have SIBO and they have malabsorption, when in fact they don't. It's assumed that you have malabsorption if you have SIBO, and that is the furthest thing from the truth on planet Earth. I'm actually gearing up to do a big series on this channel about malabsorption and malnutrition, maldigestion, and kind of telling them apart and how to test for malabsorption. So if you think I'm full of hooey, and you're shaking your fist at the screen right now saying, screw you, lady, I know I have malabsorption and I know I have SIBO, then don't worry. Your time will come. I have some videos in the pipeline in the next couple of months all about malabsorption. So just hang tight. I need to produce those and I need to finish my research phase before I get to production. But yeah, that's how the cookie crumbles. I think a lot of people who are told they have SIBO don't have SIBO. And I don't want to sound like a SIBO denier, but I'm kind of turning into a SIBO denier in a weird way, which is very hilarious and ironic given this channel. Oh my goodness. Well, anyway, guys, I'll see you in the next video. Bye. And if you feel like I'm a horrible meanie pie who just took away SIBO from you and now you don't know what to do and you're freaking the F out, I'd encourage you to join FODMAP Freedom. We are enrolling again in August, and then again in February. It's August and February every year, people. Get the swing of this. We teach you how to heal your gut, whether or not you have the label of SIBO. It doesn't matter in FODMAP Freedom because we take a head-to-toe, inside-out, outside-in approach to your tummy problems. So the labels don't matter. IBS, SIBO, mast cell, it doesn't matter. We're going to figure you out one way or another in the FODMAP Freedom community. We've got great support. We've got the Q&As between me and my FODMAP Freedom coach, Stephanie. The Q&As are bomb diggity dog. The curriculum itself is snap, crackle, pop. So good. And we cover everything you need from nutrition to the microbiome to motility to the gut-brain axis to sleep and stress and toxicants and detoxification and prebiotics and probiotics, you name it. We cover it all, but we do so in a way that is streamlined and just gets down to what you need to do and how you can feel better ASAP. So if you want to just cut through the bullshit and feel better with or without the SIBO label, FODMAP Freedom is calling you. The link to register or join the waitlist, depending on what time of year you're watching this video, can be found down in my link below. Go ahead, check it out. If you sign up for the waitlist, it's no obligation. You don't have to join. I'm not going to come knocking on your door demanding your credit card or something, but it at least gets you on that waitlist so that you're the first to get emails when we are enrolling again. So check it out. What have you got to lose? With a 100% money back guarantee, I would say nothing, but that's for you to decide. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.